Welcome back. Every clinical ethics conversation you'll ever have uses a shared vocabulary, the four principles of biomedical ethics, from Beauchamp and Childress. You need to know them cold. Autonomy. Respect the patient's right to make informed decisions about her own care. Beneficence. Act for the patient's good. Actively promote her welfare. Nonmaleficence. First, do no harm. Avoid inflicting needless injury. And justice. Distribute the benefits and burdens of care fairly. Essential but incomplete in two ways. First, the principles tell you which considerations matter, but not what to do when they conflict. A patient autonomously refuses treatment you believe she needs. Autonomy versus beneficence. Limited clinic resources spent on one complex case mean less care for others. Beneficence versus justice. The principles cannot adjudicate their own collisions. Second, and more deeply, they are nearly silent on two things this course treats as central: character, what kind of person the practitioner should become, and source, where our deepest moral commitments come from. Those two gaps are exactly what the faith-based and comparative traditions address, and it's why this course doesn't stop at the four principles. Now, where did modern ethical safeguards come from? Not from theory, from atrocity. Four turning points. 1947, the Nuremberg Code, written after the trials of Nazi physicians, makes voluntary informed consent non-negotiable. 1964, the Declaration of Helsinki sets the profession's own standards for human research. 1972, the Tuskegee study is exposed. 40 years of deceiving black men who were denied treatment for syphilis, even after penicillin was available. It remains a defining American scandal and a root of medical mistrust in many communities. 1979, the Belmont Report distills the lessons into respect for persons, beneficence, and justice, the foundation of research ethics to this day. The through line: safeguards are written in the aftermath of harm. Forgetting the history is how abuses recur. So, where does this course go beyond the principles? Into the traditions, the biblical and Jewish concepts of imago Dei, covenant, and the prophetic demand for justice, the two great commandments, Islamic maqasid al-Sharia, Hindu and Buddhist ahimsa and compassion, Maori concepts like tewer tapawa, and secular frameworks of reason, dignity, and human rights. The principles name the considerations. The traditions tell us who to become. That's chapter 1. Next, we build the foundation everything else rests on: moral reasoning, biblical ethics, and faith-based frameworks.